Hey guys, it's a great day to be healthier and happier without knee pain. I'm Dr. Blahnik here at the Knee Spa Service Center in Clearwater, Florida, Tampa, Oldsmar, St. Pete. We're off of I-19 next to the Fresh Market. Jason's Deli's kitty corner to us. But what we're going to do is we're going to show you how we help people. So spinal decompression, which you're going to be using, is meant to facilitate that process called imbibition. And imbibition is, again, allowing the nutrients to be driven into the cartilaginous tissue here, which is the vertebral discs. So they don't have like a bunch of arteries bringing nutrients to them, so they get them through imbibition. So if you think of this like that sponge or a sponge, when you're walking, what you're doing is you're pumping the sponge and it's getting nutrients in there. You have a sedentary lifestyle, desk job, you're kind of like this at home all day. Those discs aren't getting that movement, which means they're not getting that nutrients into the tissue. So spinal decompression is essentially automating a process where you're decompressing the discs, particularly good for somebody with like degenerative disc disease, slip discs, herniated discs, decompresses them, but we also have a pulsing impact where it goes back and forth, back and forth. Really great for somebody like dealing with sciatica or kind of radiating pain, spinal pain in the low spine. So that's decompression versus a scoliosis where the spine might be like this. What we're going to be doing is we're going to be pulling it back to neutral. So Luis, one of the things we're going to do is do a digital posture analysis. Okay. So I'll have this printed out and measured for you by the time you leave. We're going to use an iPad to take those pictures. So let me show you what we're looking for, okay? On digital posture analysis, it's going to analyze it, and what we want to see is that your head is level, your shoulders are level, your hips are level. And when we see that typically in this posture analysis, we tend to see a normal straight spine when we take x-rays and imaging studies. So with normal straight spine, the nerve system's at 100%, you're reaching your God-given potential for your health and your organ development. All right. Compare that to here though, maybe on this posture analysis, you notice maybe your head's tilted, a shoulder's higher, perhaps a hip's lower. You could have a misalignment, you could have a subluxation, you could have a scoliosis, even worse. My question is, if this was happening here, what do you think it would be doing to these nerves? So if you have this pinching here, what do you think it's doing to these nerves?
Pressing them.
Okay, and if you're pressing on nerves that go to these organs, like you can't feel your spleen right now.
Yeah.
If you're pressing on these nerves, maybe it's a nerve going to your kidney. If you're damaging the flow through those nerves, what do you think happens over here to the organs that you can't feel?
It wouldn't work properly?
Properly, yeah, function properly. So the power God put in your brain and nerve systems controlling all function. It's beating your heart, making your lungs breathe. It allows you to see and hear me. It's allowing your kidneys to cleanse the blood system. And if you have this, what you have is you have silent problems here, and most people don't even connect the two. So we're going to take a digital posture analysis. You'll have this, and then we'll see on the inside, how does it look? Because if it does look like this, we're going to get closer to your God-given potential here. So if you will, the accuracy of this is only as good as the input. I want you to find the top of your pelvis, your hip bones, with your thumbs. Mm-hmm. So just go like this, the top of the pelvis. Dig in there, both sides. Stay real still. Now you're just going to turn and face this way. All right, so I'm going to have this starting to digitize. We're going to take some pictures. Picture of your spine from the side and then front and back. Okay. So the digital posture analysis is one thing. We don't like to guess. This will tell us real time.
Okay.
So first picture, you're going to face this way. Just have your shoulder firm up against here. What you want to see on your x-ray is what your spine looks like normally. Mm-hmm. Okay? And the reason I say that is when somebody gets in front of this, sometimes they want to do this. They're trying to impress the doctor. You just want to see what your spine looks like. So just firm up against here, face this way. We'll see what it looks like. I'm going to take a couple measurements here. Mm-hmm. Just keep your arm where it is. Just relax. It's not. You can see a bend, but it's not. It's not significantly a scoliosis. So you don't have it.
Okay.
A scoliosis.
Great.
In this area. Up in here, you can see what I see. This is your collarbones.
Yeah.
And if you just picture a straight line through here, what do you see? Yeah, huge. But that's up here.
Yeah.
That's not where you have the most discomfort. Yeah. So there is some things happening down there, and I think that's where I think you'd be a great candidate for spinal decompression, corrective care, scoliosis correction. I don't think you need that.
Okay.
That's not what.
What is this?
So that is a cervical thoracic. You do have a scoliosis up here, mild, but it's not the thing that you thought it was down here. So that's mild, and those are things that we can work on correction-wise, and I'll show you some techniques and things, but not necessarily a candidate for the scoliosis machine. However, we're going to go over there. So if you look on this side, this is the left side, and then this is the right side.
I have my ribs here popping up a little bit.
So if we think of this as the right side, we want to pull this this way, don't we?
Yeah.
We want it to go this way. So you're going to have a pad. I want you to just do this for me. Say low right.
Right here.
That's one pad. And then up here, we're going to go high left under the armpit.
Okay.
So we're going to look at this like correcting a scoliosis. Come on with me.
All right.
I think what you're going to benefit most from is spinal decompression.
Probably.
And then shock wave.
Oh, okay.
I think this will help you a little bit, but that's not where the main component is. So if you want to just have a seat. All right. So now I'm going to start to correct the scoliosis. So just like braces, it's not meant for comfort. It's for correction. And we're going to do some tractioning now, decompression.
Yeah.
It's going to go upwards. So there you go. Keep that under your chin.
Under?
Mm-hmm. Feel that? Okay. So essentially, scoliosis, true scoliosis, a lot of people are looking at x-rays and they think left and right. And that's not necessarily how the spine gets damaged in a scoliosis. It's kind of more like a coil. So if this is straight, what gravity does over time is it coils the spine. And so there's mild, moderate, and severe. And what we're doing right now is we are uncoiling the spine, de-rotating the scoliosis, improves lung capacity, improves the nerve system function, because ultimately what gets compromised when your spine is scoliosis or misalignments, what chiropractors refer to as a subluxation, is you're putting endangering tension and stress on the nerves, the nerve system, and that affects organ function. So we have decompression of the cervical spine while we're straightening out, we're pulling that spine back into place where it needs to be. That's the medieval torture device. Far better than filleting you like a fish and sticking Harrington rods. There are non-drug, non-narcotic, non-surgical interventions for scoliosis intervention. How's that feel? Pretty intense?
Not so much.
Okay. I'm going to stop that, and we're going to get you out. That's good. Put your arms over that.
Over this?
There you go. I think that's pretty close to about good, yeah. Take a deep breath in, blow it out. All the way, all the way, all the way. Okay. Now we're gonna lock you in. Okay, ready for the ride? You got your tickets?
I do have
So we're adding a heat and a vibration to this.
Okay.
So initially what you're going to notice is it's going to decompress your spine, and then it's going to start to move it from side to side. I want you to hold this, focus on that, keep your arms down this way, keep them down, tight. So we're starting pretty gentle today. So on this side, what's happening is we're opening up this side of the disc. If you could picture it being pinched, somebody wants relief on this side, and then we're going to come to the other side. So we're going to check your range of motion and mobility.
Okay.
Yeah. What you're going to do is focus on where your feet are. Think about your knees. And when you do a squat, this is what we're going to do. I'm going to have you do a squat.
Okay.
You're going to essentially try to get your knees to come out. Pretend you have a chair behind you, which means just stick your bum out like you're going to sit on a chair. And the instructions are pretty simple. You're going to raise your arms and then squat down until you can't squat.
Okay.
And then come back up. So just follow the prompt here.
Okay, here.
All the way up. Keep them there. And now drop your bum like you're going to squat as far down as you can go.
Okay, there.
And then follow her back up. And let's do another one. And up. And it looks like you got one more to do. Good job. And up. Bring your arms down. Come on in. So now we have some results for you,
Okay.
which is pretty awesome. You got a mobility score, a stability score, your posture, and then symmetry. So if we look at mobility, there's more data in this. I'm going to email you all of these results.
Okay, awesome, thanks.
This is actually picking up problem points that you may be having in your
Yeah.
hips and then somewhere in here that might be preventing you from more mobility. Stability, different things, your posture, and then symmetry. So some problems.
Yes.
You got hip and shoulders. Does that correlate with anything you've been having at all?
Yeah.
Okay. So I'm going to get this email to you. If somebody generally comes in with a knee ache, it's usually not just their knee, and it's usually a tissue issue that turns into a structural issue. But at the end of the day, when somebody's like, hey, my right knee hurts, can you look at that? What I want to do is ask permission to look north and south of the problem. And that's kind of where this comes in. So just like a posture analysis, we would want to see is, you know, your head level, your shoulders level, are your hips level. And as we look at more of a digital posture analysis, we can start to see some of this. So you guys remember the old song and dance, the hip bone's connected to the thigh bone. Well, things down here, problems down here where people are getting cortisone shots and just want the pain to go away, we would have to look at it more holistically, which is there any contributing factors? Is your pelvis or your low spine? Are your ankles? What's happening north and what's happening south of where the problem is? And that's why we analyze it more comprehensively, not just trying to treat the symptoms of knee pain. Does that answer your question? Okay. Good. Side of things, many people are more familiar with red lights or light therapy. So this is a combination of infrared as well as red lights, pulsing. We have a new technology coming in where it's going to be a PEMF technology with both of these, but correlates perfectly with the integrative side of things when we're rehabilitating damaged knees, damaged nerves, damaged blood vessels. As many people are learning, infrared or red lights stimulates the blood vessels. And with knee rehabilitation, we're looking for flow of three things. So circulation. Generally, when people think circulation, they think blood flow. So this is going to stimulate blood flow, circulation of nitric oxide, the production of endothelial basal growth factors from that. So that stimulates that, Plus it has more of an inflammatory response to it. It's going to help to decrease inflammation. But circulation, when you think of that, what comes top of mind is blood flow. But also circulation means nerve flow and lymph flow. We can't neglect the lymph chain and lymph flow when we're dealing with rehabilitating knees, particularly nerves. You can't ignore those as well. But we are trying to address every component of rehabilitation, blood flow, lymph flow, and nerve flow as it comes to taking care of knees. So we do have infrared and red light therapy room. In addition to that, we're going to talk about offsetting from a clinical knee decompression to an at-home version of this. And we're the only ones that have this. And so we want to be able to have you do this at home, but this is a home knee decompression device. Show you in a minute.